This is an ultrasound study of a 15 years old girl, young girl, with the complaint of anemia on lab and pyuria, hematuria, proteinuria, and weight loss, nausea, vomiting, and she is suffering from this complaint for the, as per she says, for the 1 month. So let us see the issue. I want to see the kidneys first and the gallbladder. This is the gallbladder. This is the gallbladder, which is okay. Normal walls, human clear. This is the protein, the diaphragm, the liver is normal. And here, this is the kidney. Yeah. This is the right kidney. And you see the upper pole. Let's see the upper pole. This is the upper pole of the right kidney, and you see that there is a lot of sludge as well as calculi. Now this is a calcification because giving posterior shadow. This is a non-calcified debris. This is a non-calcified debris, bleed or pus. Now this is another cystic area. Now this is the mid region and the lower pole of this patient. Now these cystic areas are basically not medullary cysts, and you cannot see any, we are not seeing any central sinus echo complex. There is loss of central sinus echo complex, and there are other calculi as well. This is a calculus giving posterior shadow. This is a dilated calyx, upper pole calyx, with echogenic areas with no shadowing. So this is a debris within it. Now if you will see that, the cortex or the parenchyma at the upper pole is thinned out, it measures only 7.0. Parenchyma measures at the upper pole 7.0 millimeters, and is thinned out because of the findings you are seeing. Okay, now let's proceed further. See the upper, the capsule is intact. This is the outer capsule. These are all dilated calyces. This is a dilated calyces with calcification giving posterior shadow. This is a calcification giving posterior shadow. Multiple calcifications are seen in this kidney. This is the right kidney of the patient. And all these findings are basically because of this. This is the pelvis. It's dilated. This is the calculus within the pelvis. Now the pelvis is dilated something around 29 millimeters with a 20.8 millimeter into 6.1 millimeter calculus within it. Now, because of this calcified area giving posterior shadowing, the calculus in the renal pelvis, we are seeing all these findings. This is the primary source which has led to later damage. Initially, there was the calculus in the renal pelvis, and then there was hydronephrosis, and the changes that you are seeing now are long-standing, ignored patient, inadequate treatment has led to the dilated calyces. These are dilated calyces, and you can see there are calcifications within the dilated calyces as well as debris. No central sinus echo complex is visualized, and the size of the kidney in length is 10.4 centimeters by 5.8 centimeters. So the kidney is enlarged in anterior posterior diameter. The normal should not exceed more than 5 centimeters. So the kidney is enlarged in anterior posterior diameter, and there is thinning of the parenchyma. This was mainly in at the polar regions. There is the corticomedullary junction is irregular. You see that the corticomedullary junction is irregular. This is the corticomedullary. Okay, now let us see the left kidney. This is the upper pole of the left kidney. Now again, the story seems to be the same, that this calculus in the non-dilated renal pelvis, this is the pelvis, non-dilated pelvis, small pelvis. This is the calculus measuring 17.7 millimeters, and this is the shadow. These are the dilated calyces. These are the dilated upper pole, mid region, lower pole. This is the pelvis of the kidney. Now these cystic areas are the pyramids. This is the pyramid. This is the pyramid. You will see that at polar regions, the parenchyma is thinned out and relatively preserved at the other regions, especially the mid region. This is the mid region parenchyma, and it is okay, but this is the medulla, and corticomedullary differentiation is seen, though there is slight increase in the echogenicity of the parenchyma. So the parenchyma is thinned out at the upper and lower pole. In the mid region is 30.3 millimeters and is normal in thickness. Rest all that you are seeing. Now in this calyx, particularly in this one, this dilated calyx, this is an evenly echogenic area which is with no shadowing, posterior shadowing, and this is bleed or pus, or however we call it, as debris within the dilated calyces. Now this is the picture that you are seeing. This is the dilated lower pole callus with a calculus in it measuring 11.7 millimeters, no central sinus echo complex is seen. You can't see, there is no central sinus echo complex. This is the main cause of the rest of the renal findings that you are seeing. That is the calculus, a large 17 or 18 millimeters calculus in otherwise. This is the calculus in the lower four calyces, and this is the dilated calyx with debris within it. This is the calyx with dependent region, settled down debris. So it almost gives a picture of xanthogranulomatous pyelonephritis, in that in xanthogranulomatous pyelonephritis, what we see is that the pelvis is small. You see that this is the pelvis, it is small, and here there is a large calculus within it. So one of the differentials for this finding will be xanthogranulomatous. Now the kidney from the supine, so from the prone position, there is sparse coarseness of the cortical region. And so therefore these findings are most commonly representative of acute pyelonephritis. Xanthogranulomatous pyelonephritis is one form of that. Now the kidney measures 9.8 centimeters in length and 4.7 centimeters anterior-posterior diameter. Now this calculus is not only 17 millimeters, it measures more than that. The pelvis is collapsed. It measures 25 millimeters, and see that the pelvis is collapsed, is not dilated. So this kidney is normal in size.